We are living in dangerous times. In the current scenario, due to the COVID-19 pandemic, there is a lot of misinformation on the internet about the disease. Such misinformation is causing fear and panic among the population, which is more damaging than the disease itself. In this regard, World Health Organization (WHO) has busted the following myths about COVID-19. There are currently no drugs licensed for the treatment or prevention of COVID-19. While several drugs trials are ongoing, there is currently no proof that hydroxychloroquine or any other drug can cure or prevent COVID-19. The misuse of hydroxychloroquine can even cause death. Adding pepper to your soup or other meals does not prevent or cure COVID-19. Hot peppers added to food does not prevent or cure COVID-19. Instead, maintain a minimum of 1 meter distance from others and wash your hands frequently and thoroughly. Protect your general health by maintaining a balanced diet, stay well hydrated, exercise regularly and sleep well. COVID-19 is not transmitted through houseflies. There is no evidence that COVID-19 transmits through houseflies. The COVID-19 virus spreads through droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching a contaminated surface and then touching the eyes, nose, or mouth before washing your hands. Hence, it is important to wash your hands frequently and thoroughly. Spraying or introducing bleach or any other disinfectant into your body will not protect you against COVID-19 and can be dangerous. Bleach or any other disinfectant can be poisonous if ingested and can cause irritation and damage to your skin and eyes. Bleach and disinfectants should be used carefully to disinfect surfaces only and must be kept away from the reach of children. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous. Drinking methanol, ethanol, or bleach can lead to disability or death. These substances kill viruses on contaminated surfaces, but drinking them can harm your internal organs. To protect yourself from COVID-19, disinfect frequently used surfaces and objects with diluted bleach or alcohol. Clean your hands frequently and thoroughly and avoid touching eyes, mouth, and nose. 5G mobile networks do not spread COVID-19. Viruses cannot travel on radio waves or mobile networks. COVID-19 has spread to many countries that do not have 5G mobile networks. Exposing yourself to the sun or to temperatures higher than 25 degrees Celsius does not prevent or cure COVID-19. You can catch COVID-19 no matter how sunny or hot the weather is. This is evident because countries with hot weather also have reported cases of COVID-19. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the COVID-19 virus or any other lung disease. The most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe forms of the disease such as pneumonia. The best way to confirm if you have the virus producing COVID-19 disease is with a lab test. You cannot confirm it with this breathing exercise, which can even be dangerous. COVID-19 can be transmitted in areas with hot and humid climates. The COVID-19 virus can be transmitted in any climate, including areas with hot and humid weather. Cold weather and snow cannot kill the new coronavirus. Regardless of external temperature, the normal human temperature remains around 36.5 degrees Celsius to 37 degrees Celsius. Therefore, cold weather does not kill the COVID-19 virus or other diseases. Taking a hot water bath does not prevent the new coronavirus disease. Since the normal body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, taking a hot water bath does not have an effect on the virus. Extremely hot water can be harmful as it can burn you. The new coronavirus cannot be transmitted through mosquito bites. There is no evidence that COVID-19 transmits through mosquito bites. The COVID-19 virus spread through droplets generated when an infected person coughs, sneezes or speaks. You can also become infected by touching a contaminated surface and then touching the eyes, nose or mouth before washing your hands. Hence, it is important to wash your hands frequently and thoroughly. Hand dryers are not effective in killing the new coronavirus. Since external temperature does not have an effect on the virus, hand dryers are not effective in killing the new coronavirus. Ultraviolet lamps should not be used to disinfect hands or other areas of your skin. UV radiation causes skin irritation and damages your eyes, but does not provide any protection against the COVID-19 virus. Vaccines that act against pneumonia do not protect you against the new coronavirus. Since COVID-19 is a new and different virus, other vaccines do not provide protection against it. Researchers are still trying to develop a vaccine against COVID-19. However, the regular vaccinations against respiratory illnesses are highly recommended. Rinsing the nose regularly with saline does not help against infection from the COVID-19 virus. There is limited evidence that rinsing the nose regularly with saline can help recover more quickly from common cold. However, such rinsing has not shown to prevent respiratory diseases. Eating garlic does not prevent infection with new coronavirus. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. People of all ages are prone to the new coronavirus disease. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advised people of all age to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Antibiotics are not effective against preventing and treating the new coronavirus. Antibiotics are effective only against bacteria but not viruses. The new coronavirus is a virus and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the COVID-19, you may receive antibiotics since bacterial co-infection is possible. There are no specific medicines to prevent or treat the new coronavirus. Till date, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. Thank you for your patient hearing.